chair is pleased to recognize the gentlewoman from Florida, Ms. Castor, for your 5 minutes to question.
Well, thank you, Madam Chair, and welcome, Secretary Becerra. It's great to see you. And I want to thank you and President Biden for successfully lowering health care costs and premiums for millions of American families. That is what Democrats in Congress intended through the American Rescue Plan. And now high-quality coverage is more affordable and available to families at a time when they really needed to put money back into their pocket. 14.5 million Americans now rely on the Affordable Care Act, and it has been a particular godsend in my home state of Florida, where we're the third largest state in the country, but we have the highest enrollment of any state, 2.8 million Americans now. That's a 28% increase over last year, largely because we were focused on lowering their costs through those enhanced tax credits. Can you briefly discuss the impact of the American Rescue Plan and what it has meant, what those enhanced tax credits have meant for affordable health care coverage? How many new individuals signed up because of those tax credits, and how many, what's the scope, and what do you predict the future holds?
Congresswoman, thank you. By the way, thank you very much for the work you did to make sure that the Affordable Care Act could be there and that we could have the American Rescue Plan to make even better the results of good quality health care available to so many Americans. You mentioned it with the numbers. Americans are speaking with their feet and with their voices in applying for these health care plans. The fact that today 14.5 million Americans can rely on health insurance because of the Affordable Care Act. 6 million of them new to the program altogether. And as you mentioned, several million in Florida by itself, one of 50 states. The fact that we can offer, as a result of your work on the American Rescue Plan, Americans a health insurance plan of quality, not a junk insurance plan, but of quality, for $10 or less a month in premiums. You can't even go see a movie today for $10 or less for one movie, let alone a full month of health insurance coverage. That's real peace of mind.
It is. In the grocery store, in church, everywhere I go in my home state, they really are grateful. I mean, this came at a time we were dealing with a pandemic, and a time when costs are really hammering our families. So thank you for everything that you've done. You must take great pride in the fact you were here when we passed it, and you're there when you see the expanded coverage of these high-quality plans. I also had some sad news from a friend last week who was just diagnosed with an HPV-related cancer. And I'm so grateful that President Biden is there to help reinvigorate the cancer moonshot. And what you've included in your budget related to trying to save American lives and lower costs again by expanding the HPV vaccine really deserves kudos. This is the first time it's showed up explicitly in the budget, and I'd say, you know, when that vaccine wasn't around when we were younger, but it is now for kids and adolescents. And what I've learned back home is when you ask parents if you could prevent your child from ever contracting cancer, would you? And of course they would. And here we have this safe and effective vaccine that's been available since 2006, but the uptake rates are not high enough. So talk to me about, you've committed now to do more on HPV. How does the department plan to use what you've identified as $5 million to expand efforts to improve coverage, and what can Congress be doing? We did pass a bipartisan bill out of this committee, by the way, and a bill through the House of Representatives that will help, but what is your plan?
Congressman, one of the things we learned with the Affordable Care Act and the enrollment, the record-breaking enrollment numbers, and with vaccines and reaching communities that are often left behind today, you have Black Americans, Latino Americans who are vaccinated at essentially the same rate as white Americans. A year ago, there was a dramatically disparate difference. And what I will tell you is that what we found is that if you go to people, instead of waiting for them to come to you, they latch on. They take up the effort. And so when it comes to HPV vaccine, other treatments that we know are effective, we're going to go to those communities to let them know about this. Because if, as you said, if they know, they'll make sure their kids get these vaccines.
Thank you very much. I yield back my time.